You are listening to Insurance Untangled podcast, where we explore the various challenges faced by dental practices due to their reliance on insurance. In this podcast, we dive deep into the issues surrounding dental insurance dependence and offer practical solutions and strategies for reducing your reliance on insurance. Join us as we interview industry experts, share success stories, and provide valuable insights to help you take control of your practice's financial future.
Hello, everybody, and welcome to another amazing episode of the Insurance Untangled podcast. This is also going to be featured on the Navigating Dental Insurance podcast. My name is Ben Tuinei, and I'm the host of both podcasts, co-host of both podcasts, that is. And today, I thought to record just a very quick and simple and easy episode regarding what's happening with UnitedHealthcare and the insurance industry. So to preface the episode for today, a lot of us know, and I know that what I'm about to say next is a sensitive topic. So we all know that UnitedHealthcare CEO was assassinated here recently, December 2024. Sad state of affairs in terms of things getting this ugly between, in this case, looks like it's directly the patient community and the executives at the insurance industry, and they're clashing. So as we've seen, and this is not a laughing matter, assault in the form of engaging in a life-taking event is something that I will never condone. I will never participate. I will never celebrate, no matter what the circumstances is. And it's just sad to see that so many people are celebrating this assassination. I know that dealing with insurance is not easy. There's a lot of frustrations. In fact, what I wanted to talk about today is the result and of this particular situation, and how that might cause for reform or cause for change. And this is a perfect opportunity for us in the dental community to step it up and to be a part of that change and to dictate the terms of those changes. So just some recent recent data here is that just in the last couple of weeks or week and a half, UnitedHealthcare's they lost $60 billion. People are just dumping their stock. You know, the other thing that we're seeing is that a lot of employers and the public in general starting to unveil the fact that companies like UnitedHealthcare have been one of the top deniers of claims. Now, this is not speculation. This is data that news agencies are finding, you know, by submitting Freedom of Information Act disclosures with whatever the insurance industry discloses to the government. Anybody in the public can gain access to those documents with a Freedom of Information Act request. And what we're seeing is a lot of those requests being submitted. A lot of our friends that work in the insurance industry, as well as the associations, are indicating massive amounts of requests and investigation into insurance carriers in general on the whole basis of this whole problem of claims denials. And it's being reported that UnitedHealthcare is one of the top deniers of claims. So what is this going to do? As news agencies are finding that people are interested in this particular story regarding the healthcare industry as it pertains to insurance, mainly because of this issue, this assassination of the UnitedHealthcare CEO, is that reporters and news agencies are finding and unveiling all kinds of data that support the complaints of doctors over the last several decades as it pertains to dealing with insurance carriers. And for us, it's fees, right? It's fees, and it's the massive amount of insurance administration that we have to pay for to get claims paid, right? Us in the dental practice, we're the ones having to go through that activity to get insurance carriers just to do the right thing, right? So one positive change that we're already starting to see is that employers are questioning their plans. They're questioning who they're partnering with for insurance in general. And what we'll likely start to see is a lot of insurance carriers now having to report things like their denial rate, right? What are their policies? So those are questions that employers are now thinking about. These are questions that we need to start to ask, right? Are we putting our employees and their families in situations that run the risk of them losing loved ones or having a decline in health as a result of insurance carriers not doing the right thing and processing legitimate treatment or reimbursements for treatment that's medically necessary that people need? So that's change number one, is that the employers are going to make changes. And it's not just one insurance company, not just UnitedHealthcare. It's all insurance carriers that are being put on notice in the sense that employers are starting to now understand and realize the consequence of partnering with health plans and insurance companies that don't really look after them. So the other consequence is something that we've already seen in dentistry, and that's the fact that a lot of doctors are going out of network. This whole thing with UnitedHealthcare, I'm seeing an accelerated amount of doctors terminating and just straight away going out of network. It's something that they've wanted to do. Now that they're starting to see what the news agencies are reporting in terms of the denial rate and just the complexities of having insurance and what that means in terms of a non-guarantee of you getting any benefits, and a struggle to get benefits. So doctors are protesting on both the medical side, dental side. I'm pretty sure this is probably in every industry where UnitedHealthcare sells plans, insurance plans, is that there's a massive amount of doctors that are going out of network. But it's not just UnitedHealthcare. For us, it's the big ones, Delta Dental and the Blue Crosses. We're already starting to see an accelerated pace of doctors getting ready to transition out of network with these dental plans. And in my opinion, this is a pure protest against what we've always disliked about dealing with insurance, right? The struggles of dealing with insurance. Now the public is catching on. So for those of you that are transitioning out of network, this is actually a perfect time to do so in a way that it supports what the media is conveying to the public, and that's, hey, we need to think twice about the insurance plans that we have in terms of, do they actually work for us or not? So both sides are protesting the insurance industry, employers and doctors alike. And that's going to lead to reform, in my opinion, right? So the more and more you see doctors of any specialty leaving insurance in lockstep, right? So that's apparently it's happening in every industry right now, is that doctors are just fed up and going out of network in the masses. Is that dental insurance, medical insurance, chiropractic, vision, and all, they have no choice but to start to reform, right? So I think we're going to see a lot of legislation surrounding insurance claims denials, access to care. We've seen what's called loss ratio laws start to make their way into dental. It's unknown whether that's going to be very helpful for the industry or not. Initial opinions that have come out from the associations, Massachusetts being the first one to pass a dental loss ratio law, which essentially, for those of you that are unfamiliar with that, before I get into the next explanation, dental loss ratio laws are laws that require the insurance industry to pay a certain percentage of whatever premium an individual or an employer pays for their insurance. So let's say I spend $1 on insurance. So $1 a month. What the Massachusetts state law pertaining to loss ratios says now, as for dentistry, it says that for the $1 that I spent on that premium, at least 83% of it has to go towards my benefits, right? As a person, a small business owner myself, like I only have fully insured plans. I don't have an employer plan. I don't run a big enough business to do a medium-sized employer plan. So I have a fully insured plan. What that means is that my plan is governed by my state here in Utah. So if I was in Massachusetts, what that would dictate is that my dental plan, rather than what I'm seeing, well, what we see here in Utah, I don't have dental insurance. Fully insured plans in our state, on average, about 50 to 55% of what I spend in terms of insurance premium reaches the doctors in the form of a benefit reimbursement. So Massachusetts is saying, no, it's got to go up from 50% to 83%, right? So medical plans and medical insurance, they have those laws already. They have those regulations that make having medical insurance make more sense in terms of it being spent mostly on your coverage, right? Mostly on benefits that subscribers need. So the reform that I predict that we're going to see is we're going to probably see more states pass loss ratio laws. We'll likely see some legislation fed up on the federal government side of things to support those dental loss ratio laws. But I do believe that we're going to start to see some more regulations or enforcement of existing regulations surrounding benefit processing on the insurance side, right? Eliminating the hassle of getting claims paid, right? So I think that's going to be more simplified. You would think that with the emergence of artificial intelligence and all kinds of advanced technology these days, that claims processing should be more streamlined and more predictable and a lot cleaner. So that's something that I see that might come down the road here in the form of legislation. Is just some assistance on that end for doctors and patients. The next thing we're seeing is that there's going to be major investigation into the insurance industry in general. Last year, Cigna was caught using artificial intelligence to deny claims, millions upon millions of claims, very quickly, right? And at any rate, the media caught wind of this, and lawsuits started to be filed by state organizations, government entities, employers, and patients alike. And so what we will likely see is that was last year. This is this year. Well, what other scandal are we going to see in the insurance industry next year? And I think the public is fed up in the sense that we are in very tough economic times. A lot of people, like the majority of the people that I know, are not earning as much as they used to, or are earning more than they used to earn, but they're not as profitable, right? With inflation, they're just being squeezed. But what you're going to see is more complaints surfacing from the subscribers of UnitedHealthcare, people that were denied the access to care or denied claims, right? Legitimate claims, and being left with the entire medical bill on their own, right? And doctors and hospital facilities being asked to write off an unrealistic amount of money after providing treatment, right? So all areas of the dental and the employer patient community are pointing fingers at the insurance industry right now, to where politicians are going to find this as something very attractive for their caucus, their base, their voter base, is fighting the insurance industry. And so I believe that if you are in politics or thinking about it, it's a good idea to push forward a lot of our own colleagues into office, whether it be at the city council level or whatever it may be, congressional, senate. We need more. We need more people in dentistry to help shape and form these laws. As these investigations continue, this is a great opportunity for the doctor community to get involved and shape that legislation and shape change to allow us to better treat patients, right? And for us to have some protections on what we're doing, right? The financial integrity of care, as I always call it, being able to receive the right reimbursement and on-time reimbursement, and a lack of filing for appeals, right? Unnecessary appeals that we are engaging with in today's day and age. So that's my message, is that with the current scandal with UnitedHealthcare, that particular sad issue, is that I think there's going to be some positives that will result from this over the next few years that are most certainly going to be directed towards helping the public, those that have insurance, and such consequences of creating change. I think a positive consequence is that a lot of that change will benefit the doctor community that is currently suffering at the hands of the greedy insurance carriers not doing the right thing and helping our patients and helping our doctors get those patients healthier. So that's it, folks. If you enjoyed today's episode, feel free to share this with your friends on social media, whatever platform that you use. Give us a 5-star review. That'll help other doctors find our content. And of course, don't forget to check out insuranceuntangleded.com for future webinars, freebies, and perks that we constantly give out there. Until we meet again, thank you for joining us today, and we hope you have a successful career. Take care.